Okay, the next procedure will be surgery number 3. This one is more of a surgical extraction. This would be if somebody's getting their wisdom tooth out, say they're impacted and they are not showing at all. So the first thing we'll do is the same as always. We're going to use that mirror and explore. Then we'll of course use anesthetic. We will use the topical anesthetic, and then the syringes, the aspirating syringes, again blue or yellow. One side note here is that if you were getting IV sedation, if you had, impacted wisdom teeth, most patients end up getting IV sedation. So you would actually be in a twilight sleep as well. They'd give you that before they numb you. Now we're going to go back and we're going to make sure they're numb. Again, unless they're, put to sleep, then they really won't be able to answer you very well. We'll go back to the Explorer. Then we need to, again, I said this, the tooth is not exposed at all, so you can't see it. So we're going to pass the dentist a scalpel. This is a razor blade. It is extremely sharp. It is only one-time use, so you want to be careful that you don't poke yourself with that. And when you're recapping that, you have to be very careful that you don't poke yourself. So they'll use the scalpel. You would be using that surgical saliva ejector at this point. That way, because it will bleed. I mean, you're cutting into the tissue. Okay. So the next thing is we're going to use that periosteal elevator. Now we need to flap that gum tissue back. That way we can expose where the tooth would be. Now in most cases there's bone over top of the tooth, so we're going to use the surgical burr. Notice how big it is. That would actually be going in a high-speed handpiece, which means that there's going to be water coming out of it, so the assistant would have that surgical HVE in their hand at the same time. Then we're going to go through the elevators. We have the small straight elevator, medium straight elevator, and large straight elevator. At this point, they should be able to use the forceps. So again, there's 2 different forceps. One's for mandibular and one's for maxillary, depending on where you're working. You have that gauze in your hand to remove the pieces of tooth. And then we're going to go to the curette. And again, in this case, there's almost always going to be a root tip pick or something else going on. So we'll go right to the root tip picks. Again, the one on the left is going to be for mandibular. The one on the right is for maxillary. And then when we've used the surgical burr, the alveolar bone, the bone around the tooth, is actually still sharp. So we're going to use what's called the rongeur forceps. Notice that there's a little bit of a spring. So that's going to clip off any sharp or high bone, alveolar bone. And then because we've clipped it off, it's also a little bit rough. So at this point, we're going to grab the bone file. And it is sharp, but it's not going to cut your finger, but it is sharp on the bone. That's going to help smooth everything off. And then before we do anything else, we want to go back to that curette. We want to make sure there's no little bone fragments in there. Again, you would have that surgical HVE or surgical saliva ejector at this point. And a lot of times in an oral surgeon office, they will also use sterile water to kind of gently rinse out that socket. Now, there are 2 instruments that are used that require you to have sutures or stitches. That is the surgical burr and the scalpel. So in this case, we will use sutures. So sutures are going to be one-time use. And what we do is have hemostats. They actually lock in place, hold it. So if you can see, it almost looks like a fish hook, the metal part. And the dentist is actually going to use that and literally sew the tissue together. As an assistant, what you're doing is you're waiting until they tie an actual knot, and then you're going to come in with the surgical scissors and cut right above the knot. And after this is done, you're still going to place the gauze in their mouth to stop the bleeding, and you're going to change that a minimum of at least once before they leave. Now, if they've had IV sedation, not only do you give the instructions verbal and in writing, but you want to make sure you're not only telling the patient, you're telling whoever brought them, a parent or guardian. So again, this is surgery 3.